Let's discuss what is fracture and what are the different types of fracture. Fracture is a medical condition in which a bone is broken, cracked, or shattered. This break in the continuity of the bone occurs due to trauma such as fall, direct impact, or high force injury. Now discuss types of fracture. First is simple or closed fracture. The bone breaks but does not pierce the skin. There is no external wound and it typically involves less risk of infection. Next is compound or open fracture. The broken bone punctures the skin, creating an open wound. This type has a higher risk of infection due to exposure to bacteria. Next is transverse fracture. The break occurs in a straight line across the bone, usually due to a direct blow or stress fracture. Next is oblique fracture. The break has an angled pattern, often caused by a force applied at an angle to the bone. Next is spiral fracture. A twisting force causes the bone to break in a spiral pattern. It is common in sports or activities involving rotational forces. Comminuted fracture. The bone shatter into 3 or more pieces. High impact trauma like car accidents often cause this type of fracture. Green stick fracture. The bone bends and cracks on one side without breaking completely through. This fracture is more common in children because their bones are more flexible.